All right, the time is running out. The deadline to enroll in a health care plan through the ACA is just a little over a week away. And we want to be clear, this is for coverage for now until the end of the year. Open enrollment for health care for next year doesn't open until November. All right, so what do you need to know? We have experts to help you navigate all of the health care processes. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They are all here to answer your questions, health insurance related, ACA related, as well as Medicare related as well. Now, here is how you get your question to our three experts. You text that question. That text number is on your screen right now. It's 336-379-5775. And we want to make sure that you know that you can text through the next half hour or so. All right, so Laura, first and foremost, the deadline is coming up August 15th.
Yes, the deadline to get a health insurance policy through the Affordable Care Act at healthcare.gov is Sunday, August 15th.
Which means that people probably need to be looking at what's going on this weekend. And we know that there's always a lot of folks who are like, gosh, there's just so many possible plans that I could go to. Morgan, what is some of the best ways to figuring out which plan is best for you?
So you really need to look at how many times you're going to the doctor. You need to know what network your doctors are in. Are they Wake Forest Baptist doctors? Are they Novant doctors, or are they independent? And then you also need to know which prescription medications you're taking, because we can look at those formularies and figure out which plan is going to be the best plan for you.
Okay, and there's a bunch of different ways for you to figure out which plan is best for you. Laura, they can go right on the ACA website and they can get some help that way.
And you can go to the website and find somebody local to you, like Morgan, that can help you step through the whole process.
Okay, and we bring this up so that you know. So Morgan is with Alliance Insurance Services. There are independent contractors who look at the healthcare marketplace and will be able to help put you in the correct healthcare plan, and they don't charge you. If for some reason someone calls someone, Morgan, and that person says, all right, here's my fee, what should they do?
I wouldn't pay that fee, and I would simply call another broker.
Okay. All right. So we're going to get to Medicare in just a bit. Catherine, that is your specialty. We're going to talk about some of the AARP helps as well. But first, we want to talk about the facts about signing up for the ACA. We've got 5 facts for signing up for coverage at healthcare.gov. Number 1 is the most important, which is sign up by August the 15th. You set a reminder on your phone, you spend some time on it this weekend, and remember what Morgan said about making sure that you look back at what all of your doctors are and things like that, so you already know before you get on there. Number 2, coverage could be cheaper than what you think. Last year, 9 in 10 people qualified for financial help to make their monthly premiums more affordable. 4.7 million uninsured people were eligible for a plan with a 0 monthly premium. So make sure you double check. All right, number 3, you have to shop and save. If you got coverage last year through healthcare.gov, you should come back to update your information and compare your options for 2021. Every single year, the plans and the prices change. You could save money by switching to a new plan that still meets your needs. Number 4, accidents happen. You know what? People get sick. One trip to the ER can cost more than a month's rent. So health insurance protects you from the unexpected. And number 5, free help is available. If you have questions about signing up or you want to look through what your options are with a trained professional, free help is on the way. A quick call or go online. We have all these resources posted for you in the Who Wants to Know section. All right, welcome back. We are here with Morgan Campbell, Laura Packard, and Catherine Sevier. They are answering your questions about healthcare enrollment, ACA, which the deadline is August the 15th, as well as Medicare. All right, this question says, my husband recently started on Medicare. He turned 65 in May. Companies keep calling him to offer him other programs at no cost. He doesn't need extra things because he's covered by my teacher's retirement health care. Does he actually need extra coverage? Morgan?
No, he does not need extra coverage. And also, she can request that they stop calling her husband. That is unsolicited phone calls. And unless he actually gave written permission, those carriers should not, or those companies should not be contacting him at all.
Okay. And it's such a complicated issue. This question, Catherine, is if you're already on Medicare, can you change your plan now instead of later this year?
No, you can't unless you had a qualifying event. But if you're already on Medicare, there's nothing that you can do until open enrollment starts again in November. And then you have an opportunity to change it.
Okay, so the Medicare re-enrollment is November. Okay.
It is.
This next question.
October.
October.
Sorry, October 15th through December 7th.
October
Sorry,
through November. Yep, ends in November. Okay. This person says, my wife is covered under Medicare due to retirement. I am not at retirement age. Can I qualify for insurance under the Affordable Care Act?
Absolutely.
Okay, so they don't all have to be on the same thing. All right, this next question, Laura, they said that they may have gone to the site to enroll for ACA and it was closed. Maybe they went somewhere else by accident?
I'm wondering if maybe they were trying to get health insurance through their employer and their employer's open enrollment period ended, because the enrollment period for the Affordable Care Act at healthcare.gov ends August 15th. So I wonder if they were going to a different site.
Okay, healthcare.gov. And you know, sometimes we like to Google things and we think we're putting in the right stuff and there's all these entries coming in on Google, but that doesn't mean that those entries are the correct one that you need to hit. Laura, this person is asking, can green card holders apply for the Affordable Care Act insurance?
That's a good question. Morgan, do you know the answer to that one?
If they have a visa or a number, they absolutely can.
Okay. And that's not obviously a question that is asked very often. Okay, I'm glad we were able to
back from the memory bank.
answer it for you. Okay. This person says, what if your husband is under part-time insurance? Can I, the wife, apply for health care for myself if he gets Medicare? I need additional insurance. That's an interesting question. I'm not sure if she's asking that the right way.
Well, if she's not eligible for Medicare, she can always apply for health insurance through the Affordable Care Act at healthcare.gov, regardless of her husband's situation, I believe.
Mm-hmm. Okay.
It's the age that's going to be the determining factor on that.
Gotcha. All right. And this person is saying, if I wanted to change healthcare, what do I do? So, Laura.
Go to healthcare.gov. If you already have a plan, you'll be able to log in with your login information and change and make different selections before August 15th. And if you are not already signed up through the Affordable Care Act, you can go to healthcare.gov and create your first account and sign up before August 15th.
Okay. And again, that August 15th sign up, that is going to cover you from that August 16th time, right, all the way until the end of the year. There's going to be another sign up for ACA healthcare, and that comes later on this fall, and that is for the next year.
Correct. So that's going to start November 1st, and that's going to run through December 15th. We are hearing that there could be some changes where they would extend it to January 15th, but that has not been confirmed yet.
Mm-hmm. This question is, do I need extra health care during COVID? I don't know that. I know that Medicare does cover many things when it comes to COVID.
COVID itself shouldn't cost you to need more health care. But having a secondary or supplemental plan if you're on Medicare is really an important thing to look at, because Medicare does not cover all of the cost of your care. And you definitely need to think about how you pay for prescription drugs.
And how you pay for prescription drugs if you are a Medicare recipient, what are your options?
So there are a couple of options. One is to have a Part D plan or a supplemental plan that pays for Part D. The other is to look at Medicare Advantage and make a decision whether or not you want to be part of what we call a Medicare Part C plan that has a prescription drug benefit attached to it.
Okay. And they're asking, is there a deadline to sign up for Medicare? We're already in August. I'll be 65 in September.
Yes. So this is our favorite question. When you are approaching your 65th birthday, you must sign up for Medicare 3 months before the month of your birthday or 3 months after. And during that time, you need to look very carefully at whether or not you are covered by an insurance, a worker insurance policy that allows you to put off signing up for Medicare Part B. If you put off signing up for Medicare Part B and then later decide to sign up for it, you could face a penalty of 10% each year for the rest of your life as you're paying for Medicare. So it's really important that you sign up during that window and understand whether or not you have coverage that would allow you not to sign up for Part B.
Yeah, and that is complicated. I know even my dad got mixed up in that, and he is paying that penalty for the rest of his life because it wasn't explained. And, you know, a lot of times you just say, hey, do I need this? And people say, well, you don't, or whatever else, but they don't explain it fully.
So please get help with this. If you have any doubt at all, people like Morgan are available. The North Carolina SHIP program is available. There's a lot of information out there. If you're working, your HR department should be able to answer those questions, but don't let that time slide without getting help.
All right, we want to put these graphics up so that you can clearly see what's going on here when it comes to Medicare. So you do have to enroll when you are 65, and if you miss that window, it's a 10% penalty. That penalty does not go away, and this is what the different parts cover. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B covers certain doctor's services, outpatient care, medical supplies, and preventative services, and that's what they're saying. You have to make sure that you sign up for it and then decide that you're not going to use that if you have other stuff. Part D covers your prescriptions. Medigap is Medicare supplement insurance that helps fill the gaps in original Medicare and is sold by private companies. It helps pay things like copays, coinsurance, and deductibles. All right, the deadline for the Affordable Care Act special enrollment period is just a little over a week away. It's August 15th. The deadline was extended to help people get through coverage during the COVID-19 pandemic. So what if you can't pay premiums because of hardship due to COVID-19? Well, you can check with the insurance company about extending your premium payment deadline, or ask if they will delay terminating your coverage if you can't pay that premium. Most of the time, though, if you aren't receiving financial assistance with your premiums, you do have a grace period determined by state law. If you're getting financial assistance, you have a 3-month grace period during which your coverage cannot be terminated for not paying your premium. If your household income has changed, you need to update your application immediately because you could qualify for more savings than you are getting now. To help us with this very complicated issue, Morgan Campbell, Laura Packard, and Catherine Sevier, all taking your questions. All right, Laura, this person says, can my 20-year-old daughter be put on my healthcare.gov plan?
Yes, since she's under 26. And as Morgan said, if she lives with you.
Okay, so your child has to live with you, your adult child has to live with you for you to cover them on health insurance. This person says, I'm working currently and don't need insurance, but I'm thinking about retiring. Can I sign up with ACA after the August deadline if I need coverage for, say, the months of October, November, and December?
Yes, because losing your health insurance is a qualifying event. So even though the open enrollment period is over August 15th, if you have a qualifying event like having a baby, getting married, or losing your health insurance, you can enroll.
All right, this person is asking, can you be on Medicaid and Medicare at the same time?
Yes, you can. And that's determined by your overall income.
Okay, and it goes with your overall income, so beware of that. This person says, I'm a postal retiree. I have Blue Cross Blue Shield health insurance. That covers my wife and myself. I'm 65. Do I need Medicare Part B? And my first question is, if you're 65, I hope you've signed up for Medicare, or you should be signing up for Medicare, right? But then the next question is, do I need Medicare Part B?
Yes. You do. And the one thing I want to just stress with people as they're thinking about retiring, there's an HR department where most people or many people work that can really help you understand the subtleties of your current plan and how it intersects with Medicare, because it's a very complicated dance and we don't want you to miss that Part B window.
When you reach 65, is the Affordable Care Act off limits?
If you did not work your 40 quarters and you're not entitled to Part A and you then therefore cannot purchase Part B, then yes, you can also at that point be eligible for the marketplace.
But normally that is not the case.
Normally that is not the case. That rarely happens.
All right, I love this question. I need cheap dental insurance. And it just doesn't exist, does it? Not for anybody.
The most rich and cheap plans are obtained through employers, large employers. When it comes to the individual market, you can get a plan for about $16. That's only going to cover your preventative care. So you'll get a cleaning and an x-ray and pay probably about $16 a month. But that's going to be the extent of a cheap plan.
This person says, I will turn 65 in January. What is the first step in enrolling in Medicare?
The first step is 3 months before your birthday, or the 3 months before or the 3 months after, you need to go on Medicare.gov and start to read and understand how to apply. If you're still working, again, I want to urge you to talk with your HR department, and then do a little bit of reading and research about what plan would best serve you, because you might be in an area where a Medicare Advantage plan would be a better choice for you, or traditional Medicare. So a lot of that depends on what your current health status is and what your needs are. And people like Morgan can help you think about that.
Okay. Laura, this person says, if I signed up for coverage in April, do I still have coverage, and when do I sign up again?
Well, if you signed up in April for this year, then you would have coverage through the end of the year. And you'll get another chance starting November 1st to sign up for coverage next year. Oh, and to go back to the question that I answered earlier, according to healthcare.gov's website, it does not look like you need to live in your parents' home to stay on their insurance plan if you're under 26.
Okay, so like they can be off at school and you can be living in another state and they don't come home anymore and you can still have your kid as that. Okay. This person is saying, I had Blue Cross Blue Shield but accidentally let it lapse for non-payment. Am I able to get it reinstated? Morgan, I don't know if you're able to answer that.
If it was terminated for non-payment, they would have to go back in, create a new application on healthcare.gov. An insurance company does have the right to go back if they enroll in the same plan and ask for that back premium. So yes, you can get it back. Just be very careful when you try to get it back, because you might have to pay the back premiums that you owe.
Okay. This person says, if I become 65 in November, can I start applying for Medicare now?
Let's see.
It's 3 months before your birthday,
Yes,
your birthday month, and 3 months after.
Yep, you're in the window. I had to stop and think what month it was.
I know. This year has been crazy. Last year and this year, right? Yeah. All right. Again, that deadline is August 15th for this year to be covered by the Affordable Care Act until the end of the year. Then you're going to get another notice that starting in October, you can start applying for the next year. Thank you so much for answering those questions. Some of them are complicated, and that's okay, that we're able to kind of think through them, process it, and figure out that answer. Thank you very much. And we thank you for being with us as well. We have all the resources that you need from AARP and the AACA right there in the Two Wants to Know section.